Hello, this is the month of September 2020. We are almost 6 months into COVID pandemic. It's been a nightmare, particularly for surgeons like me and hospital entrepreneurs. How to sterilize your hospital during this pandemic? We didn't have solutions. We didn't have protocols. There were no SOPs, no guidelines when the pandemic started. It was so difficult to run a hospital, particularly when you have so much of positive patients or suspected patients coming into the hospital. You don't have the time to cleanse your accident and emergency, your CT scan room. CT scan was the mainstay because initially we didn't have the COVID testing. Most of our cases were being subjected to HRCT of the lung to know whether any evidence of COVID was there. So we have been pondering over the idea of ultraviolet rays, particularly the ultraviolet C rays, and we didn't find any reliable person who was able to give me scientific evidence on the uses of ultraviolet C radiation. That was the time I came to know about Dr. Govindaraj and Mr. Rajshekhar of the AUM Tech from Chennai, India. There's been such a nice time since I met them and personally interacted with them. There was so much of documentation they gave me which really satisfied me, and I got the evidence from the people who are just bought that AUM UVC bot. Since we run 2 hospitals in Trichy, and one is a cancer hospital, one is another COVID designated hospital, and finally we had to buy 2 UVC bot, which were 12 light bot we bought. After buying it in the month of April, it has become such an easy way for our staff, particularly our housing department, to cleanse the entire emergency, the CT scan room and the hospital, the area the waiting area where we receive the patients. And now what I would say is the turnaround time for a CT scan has dropped such drastically. We are able to do double the number of cases which we are doing before that. And as you know, practically cleansing with Lysol and doing this will not happen in our scenario. So this gives enough scientific evidence, and UVC bot for a room of 15 by 15 we have been able to clean within a matter of 5 to 7 minutes. It is so wonderful, and we have started to use it in our operating rooms, also in our ICUs, and I should thank again the company AUM Medtech for bringing it to India at an affordable cost for the Indian scenario. Thank you again.